Hello guys and welcome back to the channel. So in today's video, we're going to be talking about how you can reflect on your work experience. So in the last video, we covered exactly how you can reflect on your volunteering and I gave two examples and a little bit at the end, I gave a short kind of excerpt that you could use, for example, just to give you guys a bit more of an idea as to how you might reflect on one of your volunteering experiences. In today's example, we're going to do exactly the same with work experience this time, however. So for those of you who haven't met me yet, my name is Joyal. I'm a fourth year medical student at the University of Cambridge, and I was in your position not that long ago. And so in today's video, I thought I would share my own work experiences and how they kind of like helped me and the reflections that I took away from them. And so if you guys are new here, be sure to like, share and subscribe for more content related to MMIs. And also please do let me know down below what you would like to see next. So first of all, before we get into things, let's talk about why work experience is so crucial and why it's so necessary. So the first thing that's important to remember is, what is work experience? What's the idea? Well, it's in the name. So it's an experience of work, right? So it's what you're going to be doing in your future profession. And the reason why you need to have somewhat of a gauge, somewhat of an interest and an idea about this is to make sure that this is something that you're actually going to be suited to or something that you can see yourself doing in the long term. And I know that that sounds quite difficult for most people who are age 16, 17, 18. You probably can't see yourself doing most 9-to-5 jobs at all, really. And I appreciate that it's a difficult situation to be in. And it's not necessarily about, at this point in time, understanding, oh, will I be able to be a doctor? That's not the point. It's more about being able to get an understanding of what it's like, to be around patients, to be part of an MDT, to be part of a range of doctors and colleagues and all the other people that you work alongside. And that's the idea of work experience. Similar to what I said in the volunteering video, there is no one-size-fits-all guide when it comes to work experience. There's numerous different ways that you can do it. I do have some recommendations this time, but like I said, you don't necessarily always have to follow it. And I know that I know and appreciate that not everyone might have equal access to some of these resources. So the first thing that I want to talk about is, like I said, okay, so why is it important? Well, it's important to understand roughly what your future career might entail. Would you enjoy spending time on the wards? Would you enjoy spending time talking to patients? Is this something that you're happy to do? Is this something that you're willing to do? Is this something that brings you happiness? That kind of thing, okay? And so that's what a lot of work experience is about. In terms of where you can actually do work experience, often people go to GPs to do it. People can go to hospital wards to do it. You can go to nursing homes to do it. And I think all three of those are really, really good experiences. And if you can't do any of them, you can do some online work experiences as well. So it could be like, you can shadow like a surgeon online. I know that certain websites and organizations offer like free online like shadowing, mentoring and kind of work experience programs. I think personally it's better to do it in person if you can. I know especially in my time when I applied, because it was during kind of like COVID pandemic times, there was a lot more of online work experience going on. But now that since that's kind of like died down, I would definitely say if you can do it in person, please do it in person. And in terms of what you actually do, once again, it's not about, going with the most high profile surgeon of all time and watching the most interesting cases, because in reality that's a very minute, I wouldn't say that's really necessarily a good understanding of medicine. I think one of the things that people do, which is a big mistake when they go and do work experience, is that they go and like watch surgeries. I would say that if you think about it, right now you're deciding about whether you want to do medical school at all, right? Whether you want to become a doctor. And then when you're in medical school, you think about, okay, so do I want to do the medicine side of things or do I want to do the surgery side of things, right? So that's what the degree stands for. MBBS literally stands for Bachelor of Medicine, Bachelor of Surgery, right? So those decisions about medicine versus surgery is something that I'm even pondering right now myself, right? So I think that it's too early for you guys to be thinking about stuff like that. So yes, whilst it is cool to potentially see a surgery or two, make sure that you don't spend your whole work experience just doing that, because it can be really boring. You'll literally just be sat there doing nothing. Instead, what I would say is spend time on the actual ward, talk to perhaps some of the foundation doctors, or really any of the other staff, and just ask them questions, right? Nothing is a silly question. And you might sound scary asking the consultant something and they might give you a bit more of a rude answer. But I think the foundation doctors are really, really nice because they were medical students very, very recently, and they were also in your position the most recently. So they know exactly the questions that you have in your mind and the fears and worries and the things that you're worried about. So what I would advise you guys is to, first of all, don't spend all your time in surgery. I don't really think gives you any positive benefit really, especially because you won't really be doing anything at all. You'll literally just be stood there watching a screen if you're lucky, or if you're unlucky, you'll just be watching people huddling around a person trying to perform a surgery. So you really won't get anything out of it. Instead, like I said, I think it's more important to spend some time on the wards. Of course, the best thing to do would be to get a mix of both, maybe, to if you want like a bit of early exposure to surgery. But like I said, it's definitely not a mandatory thing at all. So yeah, in terms of what I would recommend, I would definitely say it's really, really good if you can to spend some time on the hospital wards, because that's where you will be for a lot of your placements. Majority of placement time is in hospitals, not in GPs. So I would definitely recommend that. It, once again, doesn't have to be the coolest ward. It doesn't have to be a ward that you're interested in. You know, like if you're really, really interested in the heart, yeah, okay, cool. You could spend some time on a cardiology ward, but if you've got, you know, if a respiratory ward is available to spend some time on, do it. You know, take the opportunities that are available to you, as opposed to saying, okay, I'm only going to spend time on this ward or that ward because that's only what I'm interested in. Because, you know, you don't know that for sure. You're only kind of high school students, sixth form students. Your interests may change over time. It's completely normal. Happens to a lot, if not most, medical students, I would say. So that's definitely something to think about. In terms of kind of like the other areas, so nursing homes, I think can be a good experience, especially for talking to patients, although it can be quite difficult because I know that some of the people there are a little bit more elderly and it can be quite difficult to communicate with them. But nursing homes, I think, can be quite good because it allows you to kind of see the way that perhaps other kind of like staff interact. Because at nursing homes, there won't be as many, let's say, doctors, for example. It tends to be more like nursing and healthcare staff, healthcare assistants. And so therefore it helps you to get maybe perhaps a little bit more of a different perspective on things in terms of the roles that they need to do as opposed to the roles that doctors do. Okay, and having an experience that kind of like that can be quite good when it comes to answering some of the personal questions that you might get asked, such as why do you want to be a doctor and not a nurse, or why do you think medicine is the right fit for you? And then you can have this in the bank when you say, okay, you know what, I actually did think about this, and so what I did was I went out there and I tried to try to see what it would be like, spending some time with a nurse or spending some time with a pharmacist or whatever it might be, etc., etc., etc. Okay, so that's just a side point. It's not a main thing, but it's something that can be really, really useful. So I would say that, yeah, nursing homes can be good. I think hospitals would probably be the golden standard, I would say, if you can, but specifically on the wards. GPs can be quite interesting as well. I think with GPs, it's a different element, right? It's more, obviously, it's the one-to-one consultations. The consultations happen much faster. It's definitely a different way of doing things. And I would say, once again, if it is something that you're interested in, it never harms you to do it. But like I said, I think spending that time in the hospitals and on the wards is really, really important for building your base knowledge about what it's going to be like for you as a future medical student, as a future doctor, etc., etc. I know some of you guys might be thinking, oh, well, I do want to do medicine, but I also do want to do research and other things like that. Is there any work experience I can do for that? There probably is. I'll be honest, I didn't really do anything like that myself. You can probably spend some time in like laboratories, labs of, if there's a nearby university, if you have a nearby uni, you could email some of the professors in the labs in certain areas. So if you're really interested in the kidneys, nephrology, you could go to the nephrology department of that uni, see which kind of professors are there, which doctors are there, if they have labs, and ask them, can I spend like a day in your lab? It can be useful, but I think one of the problems, and this goes for a lot of things that when you're doing as like a junior, the problem is that often you won't really understand what's going on, and that goes for pretty much anything. So when you're on the ward round, if you spend some time doing a ward round with a doctor, you'll be really, really confused, right? Because you have no medicine knowledge. It's completely normal. Same thing, if you spend some time in a lab, you might be really confused with the things that they're doing because your scientific knowledge might not just be there yet. However, don't let that kind of distract you. Don't let that kind of hinder you is one of the important things I would say, because you might feel really bad on the ward round because you're not getting involved at all and you're like, oh, I don't know what to do. I sometimes feel like that myself as a medical student, and so it's a completely normal scenario, right? Remember, these guys, this is their full-time job, right? But more importantly, it's not only about your experience in terms of, are you getting involved? Remember, it's more about, okay, this kind of atmosphere, like, do you like speaking to patients? Can you see yourself doing this? Can you see yourself doing some of the tasks that they're doing? Do you think you could adapt to this kind of like high profile situation, this high pressure situation? So those are the kind of questions you should be asking yourself. And it's completely normal to have less than satisfactory experiences. Okay, so it might be that the doctor that you're meant to be shadowing for like a week on work experience pretty much kind of ignores you a little bit, and unfortunately there's nothing you can do about it. I think it's, obviously it's really poor on their behalf. They should obviously be trying to act a little bit nicer towards you. But unfortunately, like I said, there is nothing that we can do about it. And so I would say, don't be put off by medicine by one experience. That's the other thing I would say as well. Okay, I think you can really enjoy medicine with one experience, like in terms of it can confirm whether you want to do something with one experience. But I would definitely say that don't be put off by one experience, because medicine is so vast. There's so many different areas and things that you can do. Surgery is just one of the things that we mentioned. That the one experience that you have that's negative is probably just an outlier. Okay, but like I said, the overall idea of work experience is to confirm that this is something that you would really like to do. And so that's, like I said, it's worth thinking about. And there are a multitude of things to do, but this time, this is something that I would recommend you to do. Definitely spend time in hospitals and particularly on the wards, to be able to get the best feel, I think, of what it's like to become like a doctor day to day in the NHS as such. And so now if we kind of like think about my own work experience. So when it came to my work experience, like I said, once again, it was a little bit sketchy because obviously COVID times, barely anyone's allowed into the hospitals, etc., etc. But I did some emailing and in the end, I ended up contacting a sister. So my mum is a nurse in the hospital, and obviously, like I said, I want to be honest with you guys. So I'm not going to pretend like I just emailed like a load of people and I just got lucky with some people. So because my mum was a nurse in the hospital, that definitely helped. And I know that some of you guys might not have any relatives at all that can have a connection to a doctor or to a sister who could, it is definitely easier that way. But that doesn't necessarily mean that you can't get work experience at all. That's not how it works, trust me. It'll just mean that it might be a little bit more difficult if you don't have a direct contact, but I'm sure that there are people who can email, and yes, not all of them will reply. Even now I send multiple emails on a daily basis asking different consultants if I can come to their clinic or if I can watch a surgery or whatever it might be, and I get aired about 95% of the time. It's completely normal, don't worry about it. But what I would say is, fire off those emails, and if you're really, really desperate, you can even just go to some of the wards and ask if you can like speak to the one of the ward clerks, and then from there you can say, okay, would it be okay if I booked, would you be able to pass me the contact of someone who'd be happy to take me around for a week or for a few days, etc., etc. Okay, so going back to my story, so through my mum, I emailed the matron of the ward, who then passed on the detail of a doctor who took me around for a couple of days. So it wasn't just that doctor. That doctor then passed me on to another doctor because he was busy for a couple of the days. And so I got a bit of a different experience. So I went to a pleural effusion clinic for 2 or 3 days. I was on for a day or two, sorry. I was on the ward rounds for the rest of it. I think I also saw like an endoscopy right at the end as well. I can't remember now, but it was a long time ago. And so this was just 1 week that I spent Monday to Friday, probably, around like a 9 a.m. to 4 p.m. kind of thing, roughly. I probably didn't stay that long every day, however. And this was just in the summer of year 12. So summer after year 12, before year 13. And so the idea with work experience, so one of the things that I mentioned with volunteering is it's about dedication, right? The longer, hopefully, I think it can be better the longer you do it. But when it comes to work experience, once again, there's no fixed time point, but I think enough for you to get an understanding. In theory, I guess maybe I should have done a little bit more. I can't remember if I did any online work experience now that I look back at it. But I think because it was COVID times and it was pandemic times, I think that our cohort who were applying had a little bit more leeway when it came to work experiences. However, like I said, I probably should have done more. But so when it comes to this kind of thing, the important thing is, you don't need to spend 4 weeks doing work experience. Like I said, you can definitely spend your summer doing better things. UCAT revision is one of them. Year 12 summer, really, really important to do UCAT prepping. So, it doesn't need to be 4 weeks. And same again with the volunteering in the care home or whatever, you don't need to spend 4 weeks on it, right? It can be a 1 week, it can be a couple of days in the GP, a couple of days in the nursing home, and then maybe even a couple of days in the hospital if you can get all three. Okay, but that's what I would say. So with this, it definitely can be more shorter term. And it doesn't have to be like a much more of a long-term commitment like volunteering. I think volunteering being long-term makes sense because of what it is that we're trying to achieve out of it, which is showing the admissions tutors that we are someone who's altruistic and someone that cares, whereas work experience is about just getting experience of what it's like in this environment that you're going to be in as a future potential doctor. I think that's the main thing. And so those are kind of some of the kind of key take-home points that I would say about kind of like organizing your work experience, where you should hopefully be trying to go, and what I would personally recommend. And now if we come on to some of the reflections from the work experience, and have a think about some of the things that I learned during my work experience. So going back to what we said about some of the kind of reflections and trying to make them like as niche as possible. So I think one reflection, which is really, which I found to be really good, which was kind of almost a mistake on my behalf. Well, it was a mistake, but it turned out to be a good reflection, which was when I was in the pleural effusion clinic, I believe. I think there was there was a patient who came in, and the clinician I was with took like a sample, like an effusion sample, and it kind of looked a bit green, and they were trying to point it out to me, the clinician. So the patient was facing one way, the clinician was facing the other way, and I could see the patient could see me, and since the clinician was behind the patient couldn't see the clinician, and the clinician was trying to point to the kind of like sample that they just extracted, and it was a bit green. And I remember like I grimaced a little bit, just a bit like almost like in sympathy, or to kind of like acknowledge that I'd seen it. I was like I just went like that basically. And as soon as I did that, the clinician just like shook their head after that, because I think the patient saw. And so afterwards we spoke about it, and of course, of course I had no idea that I shouldn't have done it, but the idea there was about the fact that obviously patients can get worried at times, and I think that when someone makes simple facial expression like that, I was simply just reacting to what I'd seen in front of me, that can have a bigger impact on them, because obviously they don't really know what's wrong with them, or even if there is something wrong. And of course I had no idea either. I just saw something that looked a bit unusual, and I thought, ooh, and I just grimaced a little bit. But the fact there is about, the amount of information that you give to patients and the way that you're meant to give it, right? So you don't want to like surprise them, or you don't want to concern them. And there are ways to go about saying things. And one of the things that I then went to later on learn was about, breaking bad news. And I know that this isn't about breaking bad news, but I guess it taught me a lot about like the professional etiquette and the way that you're meant to kind of like handle matters when you're going about doing these things, right? You don't want to alarm the patient unnecessarily. So, in that moment, there wasn't a need for me to do that. I should have just noted it, stayed calm, and then we could have discussed it later, either with the patient or with the clinician themselves. But by me doing this, it alerted the patient a little bit, and perhaps might have put some unnecessary worries and doubts into the patient, which could have made the clinician's job harder when they were kind of getting the sample, right? So it was a very, very subtle thing. And yeah, you might say, of course, yeah, about whether it was my fault or not. And I would say it was my fault. But anyways, it doesn't matter, right? Like, no one is perfect. The whole idea is about learning from the experiences that we have. And I thought that was quite a good reflection, because here I'm kind of being vulnerable, and I'm saying, okay, you know what, this is what I did, and this was bad. I shouldn't have done this. And I'm saying what I've gained from it, because of course you guys are just sixth formers, right? They're not expecting you to be, and they don't expect any medical student ever to be a perfect doctor, right? That's what medical school is for. And you could even argue that there is no perfect doctor, and that it is a constant learning process, that you just get better and better and better and better. So it's fine to make mistakes, but it's good to acknowledge them. And so, like I said, I'm not saying that you always have to say in every single reflection that you made a mistake and then you corrected it or you learned something. But here, this is kind of like a pertinent reflection that I made myself, that I thought was quite good. And so I think that's really, really important. And in terms of kind of like, if we come to some of the other reflections, and I think another really good reflection that I kind of, which was based off an encounter that I saw with a doctor and a patient, was often, when doctors are asking patients about their symptoms and their problems, one of the things that they're meant to ask about is something called ideas, concerns, and expectations. And so the idea is that you ask them, okay, do you have an idea about what's going on? What are you most concerned about? What are you expecting for us to do? Because what will happen is patients will often have a lot of problems. And remember, the problems that the patient has, they can vary a lot. And of course, the one that they think is the worst might not actually be the one that's worst from the doctor's standpoint. Okay, so if you have an elderly patient who's had a fracture and has all of these different issues such as pain, etc., 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 and the doctor thinks, okay, you know what, they need rest, they need to recover, but all the patient's thinking is, I need to get back home to my dog, right? That's a conflict of interest, right? So you need to be on their side. That's the idea, right? So that's why like things like patient autonomy is so important, and why the patient's wishes always have to be respected. And as part of that, one of the things that is really, really important for doctors to do, and which I didn't know at the time, is that you often ask patients, okay, so what can I do for you today? right? So what is the one thing that you want me to address the most? What are you most concerned about? And so when they ask these kind of non-medical questions, right? It's not the, do you have a fever? Do you have any chest pain? Like, it's not these classic questions that they might ask. It's more these non-medical questions that can actually reveal more information and can help the doctor to formulate an appropriate treatment plan. And I think that's really, really good. And so that was one thing that I saw on my on my work experience, and I thought, actually, that's a fair point. There's a patient in front of me here who perhaps needs 4, 5 or 6 medications for the issues that she has, but out of all of them, she doesn't really care about the pain that she's in, and all she cares about is just being able to go back home, right? She doesn't care necessarily that if she doesn't take rest for the next 2 weeks, she might get worse. No, she just wants to go back home to look after her dog because there's no one else to look after a dog. And so it's these kind of considerations that have to be taken into account, because every single patient is so complex, and everyone has different needs and priorities. And so, yeah, watching the doctor do this kind of made me realize, actually, it kind of makes sense why they're doing this, but I hadn't really thought about it before. And it made me appreciate that the doctor's concerns might not mirror what the patient actually wants the doctor to solve, and what the patient actually wants to get out of this consultation, and what the patient wants to get out of their stay in hospital, essentially. And so by asking these questions and by being direct, the doctor can get a bit more on the same wavelength as the patient. And so I think that's something that's definitely very, very important to consider. And I thought that was quite a good reflection. The other reflections that you get that can be a little bit more common are things like, I saw a doctor behave empathetically when breaking bad news, or I saw a doctor behaving professionally. And so when people tell me these reflections, I just don't regard them as highly, because I kind of think to myself, okay, do you not expect a doctor to behave professionally? Were you not expecting the doctor to behave ethically? Were you not expecting the doctor to show empathy? Because the fact that you're saying this, tells me that perhaps this wasn't something you weren't expecting, which is obviously not true, right? This is the bare minimum that you're expecting from these doctors. And of course, it's not a dreadful reflection, but I think it can definitely be made better. So try and go for these more kind of pertinent reflections, these more stronger reflections that can definitely be more useful. And actually, that will help the admissions tutors as well, because they'll be like, oh, actually, you know what? This person actually properly engaged on their work experience. They're really thinking about the scenario they were in, the environment they were in, and they really seem to have learned a lot from it. Okay, so yeah, I think it's a very, very important thing to think about, not just kind of basic, simple take-home messages, but something that can be a little bit more complex, and that in itself can be very, very useful. So the same as last time, I thought I would give you another reflection, which perhaps isn't something that I directly thought about, but I kind of just made up here, essentially. So you could say that during your time on placement, that you noticed how crucial kind of non-verbal communication was in these kind of clinical settings, because often it can reveal a lot about patients. So patients' body languages can often express anxieties, express worries or discomfort that they might not disclose themselves in a potential history or when the clinician is talking to them, which highlights how important it is for clinicians to observe kind of generally, and not only listen to their words, but also, look at the patient and try and essentially interpret and understand their body language and incorporate that as part of the information that they already have. And so being able to do this is a really, really effective tool because, it allows you to just get a better understanding of your patient. So yeah, that's just a simple reflection that I just kind of thought of, which is definitely better than some of the more generic ones, like I said, but definitely can use improvement. So exactly the same as I said for the volunteering video. If you guys have your own reflections, I would absolutely love to hear them. Please do comment them down below, and I will reply to all of them, and give you guys some feedback on what I liked. And also, feel free to criticize any of my reflections as well. I would love to see where I can improve. But if you found this video helpful, please do let me know down below. Make sure to like, share, and subscribe. And keep an eye out for more content, especially regarding MMI interviews coming up soon. Take care, and I'll see you guys in a bit.